And this topic is really near and dear to my heart. And I'll tell you a little bit about why. First of all, at the Viva Center, I actually see clients who come in who are facing chronic illness or serious illness. I see people for grief and loss, as well as other types of trauma. And I do also work with people who have experienced PTSD as either a consequence of serious illness or some form of medical treatment, usually for serious illness, not always. And I was formerly a medical social worker. I worked at Children's Hospital in the bone marrow transplant unit for about 4 years, and I worked in palliative care in Washington Hospital Center for about 3 years. And in both settings, I worked with people who were in advanced stages of illness and going through a lot of medical treatment. For those of you, people don't always know what palliative care is, so I'll just briefly explain that palliative care is a holistic approach to medical treatment, usually conducted in the best case scenario by an interdisciplinary team that includes social workers and chaplains and sometimes pharmacists and certainly doctors and nurses. And so when people are going through treatment, palliative care not only helps to ease physical symptoms, but provides emotional, spiritual, and psychological support. And I'm going to come back to palliative a little bit, or mention them a little bit later in the presentation. But why are we, so I'm interested in this topic, and I hear that others are, but why is this topic important? Because this happens not infrequently when people are going through treatment, and yet it's really unrecognized in medical settings and unacknowledged. The research that has been done, there is beginning to be a growing body of research, tells us that the people experiencing PTSD from medical treatment is not necessarily uncommon, and it also points to some circumstances in particular in medical settings that actually increase the risk of medical PTSD. PTSD associated with illness or treatment can actually be harmful to people in a different way than other types of trauma, in that it can negatively impact the provision of care. So one of the things that happens with trauma is that people avoid triggering circumstances naturally. It's a protective mechanism, but when you're going through treatment, avoiding appointments, avoiding procedures can be truly detrimental to your health. And, since we're in a period of a pandemic, there's symptoms of COVID, including difficulty breathing, which is what a lot of people have experienced, as well as some of the typical treatments, particularly initially in the pandemic, when lots of people were going on breathing machines if they were going into the hospital. We know that both the symptom of being unable to breathe and intubation in a hospital increases people's risk for PTSD. The other really complicating factor here is that, while we've been in a pandemic, anyone who goes into the hospital is unable to have people at the bedside. And that feeling of being unaccompanied by a caring other can increase a sense of powerlessness that people feel, and the inability to have an advocate at the bedside or just a supportive presence also increases that feeling of being alone with whatever is going on. And that we also know can increase risk of not only medical PTSD, but trauma in general. So I wanted to just start, and this may be, I may be going over information that you already know, but I did want to just kind of review a little bit, what is trauma? Like, what do we mean when we talk about trauma? So trauma is an event or an experience that is perceived by our nervous system as life-threatening. It gives us a profound sense of helplessness and or lack of safety. So when we experience a threat, something that feels threatening, our first response is to fight. And if that's not possible, our next response is to flee. When those two options for protecting ourselves become unavailable, then we are left to submit in some way to what's happening. And when we do that, that's when trauma happens. So we're sort of caught, and our nervous system reacts to protect us. We'll talk a little bit more about what that may look like when we're sort of caught there, but our nervous system is still trying to protect us from whatever is truly fearful. Trauma is a hidden memory recorded in our body that causes us to physically re-experience an initial fearful event. And here I wanted to actually kind of share my own experience of medical PTSD as a way of illustrating how trauma operates. So I was, my mother died in 2006 from ovarian cancer up in Boston. She was in a hospital for a month prior to her death. And during that time, she underwent a lot of medical treatment and interventions, including being in an ICU on a breathing machine. And that was just a period of extreme stress, fatigue, and just overwhelm for me. I was in the hospital with my family every day. There were nights when I was sleeping over the hospital. My sleep was completely disrupted because it's, of course, really hard to sleep in a hospital. And I also knew my mother was dying. So after my mother died, I came back to Washington, and sometime later, several months later, I went to my gynecologist for just a regular checkup. And I noticed during the appointment that I was feeling kind of disconnected. Like, this is a person I knew for a long, like I'd been seeing her for a long time as my doctor. I felt really disconnected, kind of numb, tuned out. I had to ask her to repeat things. And I didn't really think much of it because I thought, well, I'm grieving and fatigued. And I went back to my car in the parking lot and I had a full-blown panic attack. Now, in that moment, I was safe. I'm sitting in my car. There's no immediate threat. But my nervous system perceived that I was, in fact, at risk. My nervous system perceived fear, and that's an example of how trauma presents in the body. So it is a hidden memory recorded in our body. And this happens because trauma distorts our body's sense of time and place. It causes our brains to perceive threats where they don't exist. And it causes our bodies to react accordingly. So, and we may during this time see snippets of images from the initial traumatic event or events, or we may just feel sensations in our bodies. And these are experiences that we commonly call flashbacks. Some of the symptoms of trauma include rapid breathing, shallow breathing, heart palpitations, feelings of lightheadedness, feeling numb or viewing ourselves as if through a tunnel or from a distance, which is something we call dissociation. Intense nausea or acute pain actually can also be associated with trauma. And feeling like you can't move. Oftentimes people explain or describe being frozen in place, like immobilized. So people who experience medical PTSD also have these cluster of symptoms. They may not have all of them, but they might have some subset of them. But there are some differences with medical PTSD. Often with other traumas, the event or even this series of events happens outside. It's external. It's in the environment. With medical PTSD, the source of the trauma can actually be in the body. So it might be the illness. It might be a medical device that has malfunctioned at some point. When I was working in palliative care with cardiac patients at Washington Hospital Center, we would see people who had PTSD from there's a certain type of medical device to keep their heart pumping that was implanted in their bodies. And when that device failed, it would send repeated shocks through their body. And people would describe this. I mean, this would actually, the shock was so strong that people would literally fall over because as if they were kicked by something powerful. So people often, that became then a fear. People had to keep the device in to keep them alive, but they were in constant worry that it was going to malfunction in that way again. So again, with medical PTSD, the threat is ongoing if the illness continues or the treatment continues. In people with medical PTSD, they also experience flashbacks, but they also experience flash forwards. And these are anticipatory traumatic states or symptoms in looking toward a procedure, a surgery, some type of care, a hospitalization. Importantly, too, symptoms of PTSD may actually trigger medical events. So a person with an elevated heart rate because they're anxious or panicked may actually trigger a cardiac event if they've got an underlying cardiac condition. So it's just an added layer of worry regarding the integrity of the physical body. And as I'm talking here, I'm focusing on patients specifically, but as I told you in my own personal example, loved ones and caregivers can also have vicarious trauma through medical treatment, being exposed to medical treatment or accompanying people going through treatment and illness. The prospect of losing someone alone that you love can be frightening in and of itself. But experiencing a loved one, either in unmanaged pain or struggling to breathe, for example, can cause feelings of extreme fear and helplessness. And the fact that people also, as I mentioned earlier, right now, are prohibited from being with loved ones while they're in the hospital adds to that feeling of helplessness, which can exacerbate deeper feelings of anxiety and this sense I'm in danger, or this situation is unsafe, puts me at risk. So what do we do about this? I focus this a little bit more specifically on what I used to do in the medical setting, which may be helpful to people who are thinking of going into medical social work. Certainly I've said I see people in my practice where I use routine trauma interventions, but with a lens toward understanding that the person is going to have to continue to probably interact with the source of their trauma. So what I have found in working with people, though, is just sometimes having a way to name this experience so that they can understand what's happening with their body, what's happening with their emotional reactions that feel really big and confusing, that can be really comforting. Sometimes people come in, I've met people in the hospital, I've met people in my office, and they feel like they're going crazy. Why am I reacting this way? And just being able to contextualize that for people can be so helpful. I was actually presenting rather at a conference last year, a mental health conference, and I was presenting on this topic. And one of the attendees came up afterwards and spoke to me and told me that he'd been living with chronic illness for many years. He had undergone a number of painful procedures, And he had experienced a lot of panic and anxiety as a consequence, but he had never heard anyone name medical PTSD in all the time that he had been in treatment. And just having a name for what was happening and being able to understand himself in that way was really powerful. So, like we do in session, and we can also do in hospitals, building a sense of safety in the body. So allowing people to safely inhabit their bodies. This does can look a little bit different with medical PTSD, but there are ways, of course, to invite in sense of well-being, invite in sense of safety and calm. And part of the way we do this harkens back to what I said about earlier when I talked about how trauma distorts our sense of time and place. So one of the ways that we bring people back to the present moment, where trauma has a harder time tricking their brains into thinking they're in the middle of danger, is with something called an orienting exercise. And I thought it might be helpful for people who may not know to just demonstrate what an orienting exercise is. And you're certainly welcome to join me in it. But it's as simple as sitting, where you are and just naming objects and the colors of objects around you. So I have used this in the hospital. I've used this in my office, and it might be something like black light, yellow wall, brown chair, black bookcase. And maybe you can take a couple seconds to just try that in the space you're in, if you'd like to. So again, it's orienting you to current time and place, present time and place. It's orienting you to your current environment, and it's telling your brain you're not back in that place of fear. You're here now. Other things we can utilize to help people feel safety in the body is movement, breath work, and guided visualizations to bring in a sense of well-being, relaxation. And we may not, with a person, for example, who's in chronic pain, we may not be able to focus the sense of safety in the area where the pain is, but we may be able to find, oh, nice, Anu. I invite you to share that later in the Q&A. But we may be able to find a place that doesn't have pain in the body. And we can begin to build from that a sense of safety and utilize that as a resource, so that the only experience of the body isn't one of disease or pain or discomfort, and therefore danger. And this, I think, finding healthcare professionals who can provide emotional support, particularly for people who are in the hospital, or even if you are a caregiver who is in a medical setting of any kind with somebody. I know that's not happening much right now, but social workers, chaplains, nurses, and as I mentioned, palliative care is just a great all-around holistic approach to easing suffering and providing comfort to people who are going through intensive treatment. And then importantly, and I think this has a lot of relevance always, but particularly in this time of COVID, when people are alone, continuing to talk to and reassure people, particularly patients who are sedated and seemingly unconscious in the hospital. We know that when people are sedated, there's often a perception they can't hear, but in fact, data shows us, or tells us rather, that hearing is the last sense to succumb to sedation. So oftentimes people who seem like they're unaware are actually aware. They can hear and they can't respond. So saying frightening things around them is only going to exacerbate their distress. So I know just from knowing people who have been in the hospital, or having friends whose loved ones have been in the hospital, something like just even having a healthcare professional hold a phone up to a person's ear and speaking to them in a loving, compassionate, kind way, and reassuring them, that can really go a long way toward helping people feel safer and like they're less alone. So I think that just the point there is that sedation does not equal unconsciousness. Really important to know. So I thought, as is customary with learning through connection, I think we often include some kind of experiential exercise. So I invite people, if you're comfortable doing so, we're going to do a little bit of progressive muscle relaxation or release. And I'll tell you the purpose of choosing, or why I selected this today. When we experience traumatic symptoms like panic or extreme stress, our muscles tighten, our breath gets shallow and rapid, as we talked about earlier. And this is so that our bodies can prepare for the threat. So we're not thinking this just happens. But when our bodies perform in this way, or when our bodies take this posture, that sends a signal to our brains that we're panicked and stressed. The brain then sends a signal back to the body: tense up, tighten, get ready for action of some sort, get ready to protect yourself. This becomes a cycle. So one of the ways that we can begin to disrupt this cycle is by changing the experience of tension in the body to one of relaxation. And again, this is something you can even do with people in the hospital, even people who may not be able to lift arms or legs, but you may be able to find some part of the body that could actually access this exercise. So I'm going to invite people, as you're able and comfortable doing so, to just, you can either sit, feel free to lay down if you want to. So as you're sitting or laying down, I'd like you to focus on tightening your muscles. So squeeze your hands into fists, and we'll focus on tightening like the stomach, the arms, and the hands. And you might want to scrunch up your face, and I won't look. And then you're gonna, as you do so, you hold your breath, and I will count to 5. And at the end of 5, I want to have you exhale, but you can actually almost sigh it out or make a noise while you're releasing. So we'll go ahead and start. Tighten, 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 tighten. Hold your breath. 5, 4, 3, 2, 1. Sigh it out. Can we try it one more time? Okay. Hopefully it feels good, but I invite your feedback in the Q&A section. Okay, so again, you can do as many parts of the body as you want. So we're gonna clench the fists, tighten, tighten, tighten the body, tighten all the muscles, tighten the stomach, the neck, the shoulders. You might even want to squeeze your shoulders up or scrunch them up. Tighten, tighten, hold the breath. 5, 4, 3, 2, 1, and release. Okay. Thank you for participating. I hope it felt good.